Hi, my name is Elisa Martin, and we're going to go over T and K administration today. So T and K, also known as tenecteplase, is a clot buster. So tenecteplase or T and K is a thrombolytic agent that is used in strokes or acute myocardial infarctions to help break up the clot and prevent the fibrin that is forming that makes things worse. When you are going to give the medication, it does have to be given in a timely manner, and we're going to go over that. So some important things to know: when you are going to be given the T and K, you have to know the risks. So we go over the risks with the patient and their family if possible. Although it sounds terrible, because the biggest risk is bleeding, the percentages are so low that it's not that big a deal. Even if you give T and K to a stroke patient that maybe they're not having a stroke, the risk of bleeding is still low enough that it outweighs the use of not doing it. Other things you have to worry about is your blood pressure. The blood pressure has to be 185/110 or lower and maintained below 180/105, because the higher the blood pressure, the higher risk of intracranial hemorrhaging. So how do we give it? We have to verify their weight in kilograms. Once we have that verified, we can look at our dosing, which is different for stroke versus heart attack. So for stroke, it's a lower dose. The max dose is 5 mLs or 25 milligrams versus MI. The highest dose goes up to 10 mLs or 50 milligrams. To mix it, it comes with a box of a syringe, 2 vials. One is sterile water and one is the powdered medication. You use your syringe to draw up the sterile water, inject, mix gently. It should turn a light yellow to a clear color. And then you draw up your desired amount, up to that 5 mLs for stroke or 10 mLs for heart attack. Check your IV prior to giving. You're gonna flush your IV, make sure it works well. And then it's just as simple as push, flush, and you're done. Afterwards, you're gonna have to monitor your vital signs every 15 minutes for 2 hours. Q30 minutes for 6 hours, and then 1 hour for 16 hours, which is why these patients go to ICU, because they have to be monitored closely for 24 hours. If they become unresponsive, or maybe you had to intubate and sedate, to do your hourly neurochecks, we're going to change from doing an NIH to doing a RASC score. So how do we educate? So we're going to educate the patient and the family about the risk of bleeding, because that is the biggest risk. If they are already on blood thinners or take aspirin, we need to be concerned about further bleeding, so they may not be able to have the medication. Other events, if you have a cardiac event going on, you may have other arrhythmias or dysrhythmias that show up after you give the medication. And then these are my references, and I hope you enjoyed this quick T and K.